Yeah, Dr. Sonia, I don't know who wouldn't want to go back 10 years. Sign me up. But you had mentioned earlier Botox and fillers. So let's talk a bit about that. Botox versus fillers. How do you respond when someone asks, what's the difference and how do I know which one is right for me?
So great question. But in a nutshell, Botox has been around. It's the gold standard. It's been around for over 50 years. It helps with relaxing the muscles of facial expression. So in general, you're looking at it for like the upper third of the face, but it can certainly be used elsewhere. Versus fillers, you're looking at really helping to restore some of that lost volume. We're helping to contour. We're helping to do a lot of things in the mid to lower face. Now, the combination approach works better, just like we talked about with all of our other procedures. So it definitely is an art. It's definitely more customized. It's designed based on your needs, your goals, your skin type, and a multitude of different factors. It truly is an art. So not any one person is going to get the same treatment any other time. And even when you come in, you might come in for a treatment, the next time it might be a little different. So it truly is an art, but we're lucky we get to have tools in our toolbox that allow us to really give you the best natural, outcome without any surgery. The beauty is that I'll have kind of, all these generations that come, and it truly does take that artful eye to know how to sculpt and how to contour and what to do and not overdoing it. And there is a fine balance. So my younger patient will come in and they're, on Instagram, they want to look their best. So they're asking more for the contouring benefits. They're looking for, some subtle lip enhancements, maybe some cheekbone filling, versus my mature patient will come in. I'm doing a lot more supportive volume loss. So I'm really helping with sagging skin. I'm helping to really create more of a lifting in the cheekbones and other areas. My younger patient wants to look really snatched. My more mature patient just wants to look more refreshed. So there is this fine difference. And then I'll have my skin of color patient that comes in who's totally different. I'll probably use less Botox and less fillers because the melanin is actually very protective. But for them, it's more about helping with blurring out some shadowing or under eye circles or pigmentation issues. So they require less filler, but we're targeting a completely different area of concern for them. So it truly is customized based on what their needs are. And the goal here is not to have the frozen look, not to look done or overdone. I always say when you go to a restaurant, you can't see the good work. You can only see the bad work. And our goal for you is to make it so that no one has to know. So we want it to look natural so that people will say, wow, you look refreshed, you look more rested, you look younger, but they don't quite know exactly what you did.